You're listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. This is Adam Rosen, and you're listening to the Your Knee, Your Health podcast. Well, in today's episode, I'm going to talk to you about breathing and mindfulness. Now, breathing is something that we really take for granted. I mean, it's something that we do all the time, every day, even when we're sleeping, and it's something that goes on for our entire life. But breathing can actually affect a lot of other things. I mean, just think about if somebody was chasing you or you were scared or in an accident. Maybe you just swerved to miss hitting a deer running across the street. Your heart rate goes up and your breathing starts increasing. Well, now what if you're sitting in a movie theater? You know, you're actually not in danger, but just the sight of that increases your heart rate, increases your breathing. And then sometimes the mind will start to think about something. It increases our nervous system. It increases our heart rate. We might just be thinking about a lecture we're giving or a test that's coming up, or maybe you're going over something in your mind that happened to you previously that scared you at that moment. And all of these things are really, really linked. So when we talk to patients about surgery, a lot of times just the idea of surgery and pain that can come with arthritis and surgery can all have those same effects on your heart rate and your breathing. And then even after surgery, a lot of times from anesthesia and sitting in bed and not moving as much, our lungs start to collapse down a little bit. They don't open as deeply because we're not breathing as deep. So very commonly, you'll see these things along the bedside in a hospital called an incentive spirometer. And it's a little machine where you're supposed to breathe in slow and deep and raise a little ball inside the chamber to let you know the volume of air that you're moving. So all of those things are important, and each one can affect our general health. So it's really important to actually take some time to sit down and actually just breathe. So there's a few things that you can do. I mean, it's something as simple as just take a couple deep breaths. I mean, you've heard that. Sometimes you've even told someone, hey, listen, just take a deep breath. And you haven't really thought about the depth of what you've been told or what you told somebody. So we can actually tweak this a little bit and make this a little bit more controlled. And I usually recommend, like anything, when you start doing it, you need to practice it. So you might say, okay, every morning and every evening, I'm going to sit and I'm going to practice these deep breaths. And then what you start to realize is that when something happens and you start to feel your breath change or you start to feel your heart rate race, you might go back to this thing that you've now practiced. And what a lot of people notice is that once they start practicing it, their normal daily breathing actually gets better. I mean, just think about someone that's exercising. Let's say you're starting to ride a bike on a regular basis and you never did previously. All of a sudden, you're walking better, you're breathing better, you feel better, you're eating better, you're sleeping better. It can have effects on our entire body. So, something as simple as, yes, take a deep breath. I'm going to introduce two other options to you. One is Dr. Andrew Weil, who's a famous doctor and has written a lot of books. He has an interesting website, lots of information, and he's given lots of talks on general health. And I actually, recommend that you look into some of his stuff because there are lots of things that you can learn from him and his take on our health. But one of the things that he's talked about a lot and lectured on a lot is his idea of this 4-7-8 breath. So what this is a series of breaths. The numbers correspond to seconds. So you're going to be doing an in breath on a count of 4, hold for a count of 7, and exhale for a count of 8, and then repeat. And when he has you do this, he has you take more of a meditation sort of posture where you're sitting upright. You can do it standing at any time during the day, so when you can do it is great. But if you're actually going to sit down and focus on this, sit, relax, and then what has been taught in a lot of meditation practices is taking the tip of your tongue and very gently touching it to the roof of your mouth. And you could do this with your eyes open or eyes shut, but in any event, what you want to do is take a deep breath in slowly on a count of 4. So now you can practice that right now. Put the tip of your tongue to the top of the roof of the mouth, sit down, and just get into a nice comfortable posture. Now breathe in on a count of 1, 2, 3, 4. Now hold it for a count of 1, 2, 3, 4, 5, 6, 7, and then exhale on a count of 8. 1, 2, 3, 4, 5, 6, 7, 8. And we'll repeat it one more time. I'll just do the counting. So we're going to start with the in-breath. 1, 2, 3, 4. Hold. 2, 3, 4, 5, 6, 7. Exhale. 2, 3, 4, 5, 6, 7, 8. Now, if you can't do those numbers, alter it. You can do 3 and 6 and 6. But the goal would be to get up to that. And you may actually find just doing 4 of these breaths, you may actually feel a little lightheaded. But what you're trying to do is feel what's going on. Do you feel the breath in your nose, in your throat? Do you feel your lungs expand? Do you feel your belly rise? Notice what you're feeling and really try to practice this. So this is a great thing that you can do. And you can try to do this once in the morning, once in the evening. Now, another option, if you're looking for some alternative, is what's called box breathing, or what's been called square breathing. This has been attributed to Mark Devine, who's a Navy SEAL in Southern California. He has a company called SEALFit and another company called Unbeatable Mind. He's got lots of books, does speaking, and runs a fitness class. But he designed this as a way of controlling your breathing and controlling your breath. And obviously, he's dealt with a lot of serious high intensity situations. So what their idea is a sequence of an in-breath hold, out-breath hold. So that's the idea of the box. And typically it's been described in a 4 count, but again, you could do it on a 3 count. You can do it on a 5 count. You can alter it a little bit. So, the idea of this is just in 4, hold 4, out 4, hold 4, and repeat. So you're doing this sequence of this box. So you can even practice this once now. So if you're still sitting, rest, get ready, and then we'll practice this just one time through. So you're ready. You're going to go in, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4, hold, 2, 3, 4. And again, you can repeat that multiple times. And again, you may actually feel a little lightheaded or woozy. So it's good to do it sitting down and don't get up quickly. Now, the breathing is really important because it's been shown that these deep breaths can actually regulate your autonomic nervous system. They can actually decrease your heart rate. So by doing these things, you're going to not only help your breath, you're going to move your lungs, but it's going to have other positive effects on the rest of your body. So definitely consider trying both of those these next few weeks. Really practice your breathing. You can do the 4, 7, 8 sequence. So it's in 4, hold 7, exhale on 8, or the idea of box breathing. Now, the other thing that I would like to talk to you about is the idea of mindfulness. And a lot of times this has been talked about more recently in the recent past and kind of attributed more to meditation. And, meditation really goes back thousands and thousands of years to Hinduism and Buddhism. And the idea back then was to really look at the inner mind. Nowadays with science, we put people in special MRIs or PET scans, and you can look at their brain activity and certain things when they're thinking or singing or talking in different areas of the brain and figuring out what's going on. But they looked at this as a different way. But, nowadays, the idea of mindfulness has had lots of positive health effects. And if you think about it, I try to think of, and when I explain this to people, mindfulness and meditation, if you do it for your own personal reasons or for religious reasons or philosophical reasons, so be it. And there are positive benefits for lots of things. But a lot of people get turned off when you start to talk about religion and meditation. But the idea is similar no matter what thing you're using it for. So the idea of having this view of mindfulness, think of it as just really focusing on some object. Nowadays, almost everybody has ADHD. I mean, you used to sit down and you would talk to somebody and you would just talk to them. But now you have a conversation and your phone's going off and you're texting and they're going off and you got TVs in the background. Even when you watch the news, you can't just watch the newscaster present the news. You have a ticker going across the bottom. You're scrolling on your phone probably now, even while you're listening to this, you're probably washing the dishes or, skimming through a magazine or, looking at the TV. So we don't have many times during the day anymore where we really stop, slow down, and focus on one thing. And when we do this, it can improve our concentration. People used to sit down and you could read a book and consume this information and hold it there. And you've seen these levels of concentration drop and drop and drop more commonly now on kids that are trying to go to school and focus. And, even you look at the time on the TV, many of them don't even watch TV. There was this big fear of commercials, giving everybody a 15-minute attention span. Well, now you're watching TikTok and you're flipping through YouTube channels and, you don't like it and swipe, click, move, go on to the next thing. And, you're getting an attention span of 30 seconds. So the idea of this thing of mindfulness, is really finding something that works or fits for you. During this pandemic, anxiety rates have risen. So it's a great time that people may find this to be super beneficial. A lot of people are out of work, so you definitely have the time to do it. I see it more commonly around surgery as anxiety levels rise due to the fear of having an operation. So I do recommend a lot of these to my patients. So there's definitely things that you can do. Now, it's hard to figure this out on your own. So if you're really interested in meditation and mindfulness, it's actually probably worthwhile for you to find an actual coach, and you can find someone locally. Some people do it online, where you can make sure that you get started in the right way. If you want to sort of do it on your own, there's lots of great apps, and I'll put that and list all of these with links in the text portion on the podcast episode. But a couple options that you can look at. There's an app called Calm, C-A-L-M, that you can look at. I've used this. I've been pretty happy with all of the things that you can use from this. Even my kids have used. They have bedtime stories, but it's interesting. They have some very good music that's sort of background music that's great to put it on if they're studying, to kind of bring the mood down and allow them to concentrate and kind of distract them from other extraneous noises. There's another app called the Mindfulness App, something that you can look for. 10% Happier is another one. Breathe, Bootify, Headspace, all of these are different apps that you can download. And, I found certain people just gravitate towards one or the other depending on how they do. And they can walk you through the steps of meditation or mindfulness, but some of them have just simple breathe techniques, just like we talked about previously, where you can watch a little circle go around and it'll, help you remember breathing in, breathing out. So little things that you can do during the day and daily updates and reminders. So some information that you can use to help your general health, especially with everything that we're going through right now, really focusing on your breath and trying to be more mindful in our daily activities. All of these may have that extra health benefit of decreasing your heart rate, lowering stress, anxiety, helping to regulate your autonomic nervous system, and overall just make you feel better. So I hope that you've found some of this information helpful. Thanks again for listening. If you have enjoyed this episode and you haven't already, please subscribe so you'll get updated on future episodes. And if you know of just one person that you think would benefit from this information, please share this podcast with them. And until next time, I'm Adam Rosen. You've been listening to the Your Knee, Your Health podcast. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.